One important kidney condition which affects children, adults, adolescents, and old people is nephrotic syndrome. Well, the word sounds a bit complicated. I'm here to simplify it for you in a bit. I'm Dr. Tanmay Pandya, and I'm a nephrologist practicing in Sarvodaya Hospital in Faridabad, and my clinic is in Hoskas by the name of Viva Kidney Care. So, nephrotic syndrome is basically a condition in which one loses large quantities of protein through urine. Along with that, the person's blood protein levels are depleted. There could be associated high cholesterol levels, and the person develops swelling of the body, especially swelling of feet, legs, and swelling around the eyes and on the face. So, this constellation of symptoms and signs and phenomena is known as nephrotic syndrome. There are several kidney conditions or diseases of the kidney which can cause nephrotic syndrome, and nephrotic syndrome, like I said earlier, affects all age groups. It is common in children, especially, but it is not uncommon in adults and older people. However, as we go through the age spectrum of nephrotic syndrome, the causes are variable. What are the symptoms of nephrotic syndrome? I just now enumerated a few of them. One of them is swelling of feet, legs, of the eyes or around the eyes and the face. Additionally, one may see frothy urine. That is, after flushing the urine in the toilet, the froth may be persistent for a while. There could also be dark colored urine. It is typically described as Coca-Cola colored urine or a black tea colored urine if there is some kind of altered blood in the urine. It could also be blood in urine. Sometimes you may not be able to see the frothy urine or the blood in the urine, but if you have done a urine test for any reason, let's say for an employment checkup, for a health checkup, for an insurance purpose, and you notice that there is protein, blood, and RBCs in the urine, then this again could be nephrotic syndrome, or it could be something related to the kidney disorder. That is when a detailed evaluation is required. Detailed evaluation includes certain blood tests, imaging of the kidney simply by an ultrasound or USG, quantification of the protein, which can be done by measuring urine output for one full day, that is 24 hours, collecting all of that urine and measuring the protein in that urine, or by a quasi-quantitative or a semi-quantitative method in which your urine report says +1, +2, +3 or +4 against the protein value. Then also we look for if there are other indicators of diseases which can cause nephrotic syndrome, which may not necessarily be kidney diseases to start with. For example, diabetes. Now, this is a very common disorder affecting a lot of people in the whole world for that matter. And diabetes is another significant cause of nephrotic syndrome. There could be connective tissue disorders or autoimmune diseases where kidney becomes a target occasionally, and then there is protein in the urine. Once we have narrowed down on the probable cause, generally we require to do what is known as a kidney biopsy. Now, if there is a combination of RBCs in the urine and there is protein in the urine, then there is a 90% chance that the biopsy will yield a condition which will define the problem, and maybe there is a treatment for that problem. Biopsy is not something that one should be worried about, because biopsy does sound a bit ominous, but remember, for nephrotic syndrome, when we are doing biopsy, we are rarely dealing with cancers, because when we talk about biopsy, people are worried about cancer. We are not talking about kidney cancer over here. The biopsy just tells us the structure of the kidney, what has happened to the kidney under the microscope, what looks like inside, and then accordingly, depending on the pattern, we can determine the cause of nephrotic syndrome and maybe we can treat it. Treatment of nephrotic syndrome varies again. Now, depending upon what is the cause, it can last for a few weeks or sometimes for a longer period, sometimes even more than a year. But yes, there is treatment possible if it is detected in a timely fashion. And lastly, certain conditions which lead to nephrotic syndrome can also lead to kidney failure in the future. So it is very important that if nephrotic syndrome has been diagnosed, then we reach to the root of the problem. If left untreated or unattended, some patients may unfortunately progress to kidney failure, and that is something that I as a nephrologist want to prevent at all costs. Don't be afraid of nephrotic syndrome, get it treated in time. Thank you.